The Non-Communicable Disease Unit of the Ministry of Health, in partnership with various agencies, held a press briefing on Friday at the ministry's Central Medical Store complex in Kotu. The briefing aimed to inform the public about the latest enforcement measures of the 2016 Tobacco Control Act. The Ministry of Health, along with the National Environment Agency, Gambia Revenue Authority, Gambia Police Force, and the Drug Law Enforcement Agency, conducted a joint operation to ensure the Act's enforcement. Speaking at the press briefing, Omar Baji, Program Director, Non-Communicable Disease of the Health Ministry, emphasized that all types of electronic cigarettes are banned in the Gambia.
Electronic cigarettes in the country is completely banned. It's different from the shisha. Shisha, the importation of shisha is not banned, but it should be in line with the tobacco control regulation. But any form of tobacco electronic cigarette, be it electronic nicotine delivery system or electronic non-delivery system, should be completely banned. All form of that should be banned. And then now we are seeing a lot of these coming into the country, and most of these products are targeting the youths, and that they are designed in such a way it has different flavors which are so attractive, and that they are in different forms. Some are in form of a pen, some are in a form of a flash drive, some are in a form of something that will just attract especially the youth folk and the women in general, because these are the people that are targeted for these products, and these are the people that are targeted for advertisement of these products. So they make so it's designed such a way that it will attract the young ones, and that we are seeing those ones in the country, a large number of those ones in the country.
Michael Mendy, chairman of the Tobacco Control Committee, urged the public to support the ministry's efforts in combating tobacco use.
I know it's not easy, and the implementation of the policies and the acts also can only be strengthened by communicating to the public, because the public need to know, and they need to be reminded of what they really need to know, so that they understand all our interventions in their own context, to be able to adhere to it and be convinced, so that they will be able to adopt positive behavior. I think with this practice, we'll be able to encourage those who are not directly implementing the interventions to be part of us.
Senior Program Officer of the Non-Communicable Disease Program, Sefo Singade, shared that they have engaged with religious leaders and school health clubs to raise awareness about the dangers of tobacco.
The intention is to get to children at a very young age, so that they will know about these dangers to tobacco use, and they will go and preach it in their homes, in their schools, in their playgrounds, and they will not indulge into the activity. We want to get them young so that they will know dangers associated to it, and they will not use it. This group too, around the country, representatives from different schools were there, and about 210 members from health clubs in the country were represented, were oriented on the tobacco control activities. We also have another orientation with community leaders. This is the village heads and ward councillors.
Commissioner of the Drug Law Enforcement Agency, Pa Bojang, noted that law enforcement role extends beyond making arrests.
Sometimes people believe enforcement is about arresting, detaining, or putting them on custody. Enforcement started from advocacy. Communicate to them, let them understand about the laws and the negative impact of what they are doing. Those are all part of, we call them confidence building. If you engage the community for them to understand their rights, is part of enforcement. I think that's why you people are here. We may arrange or we may design certain means of communication, but by using or going through you, it will be very easy for them to understand what is our intention.
The Tobacco Control Act of 2016 was adopted in December 2016 and came into force on December 17, 2018. Provisions regarding smoking in public places and tobacco advertising, promotion, and sponsorship were implemented immediately. The Tobacco Control Regulations 2019 provided specific details on health warning content, sales restriction, disclosure requirements, smoke-free areas, and enforcement. These regulations became effective on October 1st, 2019, although future health warnings were initially scheduled for implementation on January 6, 2021. The date was later postponed to September 6, 2021. Reporting for Kirfatu, I am Fatu Silla.